Hi, I'm Dr. Ivan Puah, and I founded Amaris B Clinic in 2004. I'm an accredited liposuction doctor and medical aesthetics doctor based in Singapore. So today we're going to talk about arm fats. I do see a lot of patients, especially in tropical countries such as Singapore, complaining about fatty arms or don't like how their fat arms looks like. Very likely it's because they do wear a lot of short sleeve, sleeveless in Singapore, and it makes them very aware and conscious about how they feel about their arms. So who get arms fats? Arm fats can be due to, of course, increased weight, obesity, or due to genetic predisposition. Some patients do have more fat accumulation, fat layers in the arms relative to other parts of the body. So what are arm fats? Arm fats are accumulations of fat layers around the upper arm that is disproportionate and often affects the body shape, contour, and the confidence of the patients. Can you reduce arm fats by weight loss or exercise? It is not as easy as it sounds, because I often tell my patients that you can gain weight, you can lose weight, you can be fitter with exercise, but it's very difficult for you to spot or target any parts of the body to reduce the fats or to make it leaner, because the body, they don't work that way. Why do arm fats affecting women more than men? Because men and women have very different fat distribution. For men, fat cells are hardly distributed through the arms or upper body. However, for women, arms is one of the areas that fat is easily distributed to, especially for patients who have more uneven fat distribution to the upper body. Usually find that arms is something more visible or disproportionate compared to men. So what do I look for as a doctor when I examine arms fats? There are a few things. First of all, I'll do assess how thick, how much the fat layers are present around the upper arms. Secondly, any existing loose skin, any stretch marks or damaged skin, and also the appearance and the shape of the upper arms as well. Do women get loose skin when they have fatty arms? Well, not really. Loose skin in the upper arms is also called bingo wings. It is present when you see your arms jiggling when moving or waving your arms. So what is the cause of it? There are several factors. First, aging. As you age, you lose elasticity and your skin will appear thinner and looser, and that will contribute to a loose skin appearance in the upper arms. Massive weight loss. If you lose weight tremendously, you're going to have overhang of skin, especially if you do have fatty arms to begin with, and if you lose a lot of weight, excess loose skin will be visible after that. Is arm fat hardest to lose? Well, I wouldn't say that, but it all depends on the body types and shape. If one belongs to the body shape where they are more predisposed to having arms fat or upper body fat, then yes, they may find that losing fat from the arms, upper body could be more difficult than other parts of the body. But conversely, if you have more fat distribution to, let's say, your waist or your hip, then you may find it easier to lose the arms fat than your hip fat, for example. So how do you get rid of arms fat if it troubles you or if you don't like it? Well, like I mentioned previously before, it's not easy for one to lose arms fat by simple exercise or weight loss. You cannot spot reduce any specific part of the body. There are methods where doctors can do to help you reduce arms fat. There are both surgical and non-surgical methods where doctors can use to help address the arms fat. Non-surgical methods such as freezing, radiofrequency ultrasound and such is designed to affect the fat cells using certain devices. The pros and cons of it is that advantage is that it's non-surgical, lesser downtime, lesser risk. The cons is that it's unpredictable. You may not know whether you will respond to it or whether you have any results. Even if you have results, whether the shape and contour is ideal. So a lot of times, patients may not find that they get the desired results. A surgical method, the most proven one, is with liposuction. Liposuction is the only guaranteed method that we can actually use to reduce arm fats. The technique of liposuction, the objective of liposuction that I often tell patients is not just to remove or reduce arm fats. Number one, of course, to help to reduce and slim down arms fat. Number two is actually to shape and contour your arms to make it look leaner, contour, tone, even muscular, depending on patient shape and objective. And last but not least, we can use liposuction as a tool to tighten your skin and connective tissue. It helps improve lean loose skin and make it look tighter and firmer than before. So that's the reason why liposuction is one of the best to address patients with arms fat, especially for those with arms fat loose skin. It's very interesting to note that there are some research paper that has been published on linking arms fat to Alzheimer's, Parkinson's risk, and risk of spinal fracture, and even be used to predict the risk of dementia. These are very early findings about the linkage of arm fats with medical conditions. For those who are affected or troubled by arms fat, speak to your doctor to see what can be done for you. Thank you for listening. If you have any questions, just email us. See you again.